counselor. You too. So, tell me what brings you in today.
Well, I'm thinking it might be a good idea that I should go on some type of birth control at this point.
Okay.
Because my boyfriend and I are, we're sexually active and really don't think it's a good time for me to be, getting pregnant.
Okay. Okay. Well, we can do that. I wasn't expecting the birth control one. Your male partner. Okay. So let me just get with that program.
All right.
Okay. So, and you and your partner, do you typically use any kind of barriers or protection?
You mean like
Condoms or?
Well, when I'm out at the store and I think of it,
Okay.
I'll pick up some, but, it's kind of hit and miss.
Okay. Have either of you also been tested for STDs and HIV?
Not recently.
Okay. Well, we do give the birth control. We have many different methods that we can offer you, and we also do STD screenings and HIV screenings. Are you interested in all of them, or?
Well, I guess not only am I here because I'm needing some type of birth control, I'm also somewhat concerned because my boyfriend used to use IV drugs,
Okay.
and every so often, I don't know, he says he mentioned something about maybe there's a possibility of HIV, but,
Okay.
it kind of, then it kind of falls off the topic, and, and we don't discuss it much anymore. And so, but being that he has that past history, and I know that could be a risk for, developing HIV, I'd like to probably clear my mind or know where I'm at, so.
Well, you're at the right place then.
Okay.
Okay. And it's great that you're here doing things to protect yourself, and we can definitely do all of those today. Just so you know first that all this information is confidential, okay? So your birth control information, your STD information, and your HIV information will be confidential. The only difference with HIV and some STDs is they're what's called reportable. That means they're still confidential, but that goes into a state database. And with HIV, if you had a positive result, then there's kind of different rules around HIV. But it's really great to know your status, because if you, let's say for someone that had HIV that waited a long time, they could get sicker, and getting on medication later cannot work as well for folks. They can already get an AIDS diagnosis.
So let me ask you this, what if I get tested and I find out I'm positive, but my boyfriend, he's never been tested, he just kind of drops, these, remarks every so often that he could be, so how am I gonna approach him, because he doesn't know I'm here today?
Okay. Well, my first question would be, well, those are good questions. Have you ever been tested before?
For HIV, no.
And has he, that you know?
Not that I know of.
Okay, so not every. Well, I can talk to you about if your result was negative or positive, how to bridge that conversation with him, and we can work on that together. I also, in terms of, talking to him, do you have any fears about telling him, or do you think, he would be, since he's been dropping hints, how do you think he would react?
Because, yeah, I guess I'm a little, have some reservations about confronting him, that I took this step, because I feel concerned for my own well-being.
Right.
So I am, concerned that, if I do tell him that I was kind of worried about my own safety due to him, that he could get a little, uppity about it.
So does uppity mean, would he get upset and, be nonviolent, or does that mean he'd be upset and could be violent?
I just think he might I'm not concerned about him being violent, but I just think he could get really worked up and probably pretty angry.
Okay. Well, there's a couple of things to consider. One is you getting tested today.
think being the fact that I've kind of taken the step to be here today, I should go forth and have that rapid test.
Okay, great. Well, we can do that. So let me get your name. You said Ann?
Mm-hmm.
And what's your last name, Ann?
Carter.
Carter. And what county are you in?
Wait.
Okay. And your date of birth?
4/6. Stop rolling out. 82.
Okay. And your zip code?
27914.
Okay. And do you consider yourself Hispanic or non-Hispanic?
Non-Hispanic.
And for your race, how would you identify?
Oh, race like Caucasian?
Okay, white. Okay. And your current gender, male, female, unknown? Okay. Transgender, okay, female. And you were born female?
Yes.
Okay, great. And I'm just gonna go through these questions and I ask them to everybody and they might seem pretty obvious, but this is just to, basically this information is, in terms of giving some demographic information about who comes in to get tested, but again, it is confidential. Okay, and today is the 21st. Okay. All right, so I'm gonna ask you some questions about your behavior, okay? And these are pretty personal questions, but I ask them to everybody, okay? And also, is there any chance you're pregnant?
Like I said, we have real inconsistent use of condoms, and that's why I'm here today to get some form of birth control that's a little bit more reliable. So
Have you missed any periods or?
I don't really keep good track of that. You know, they kind of come when they.
Okay, so I'll put unknown. And, okay. All right, so I'm gonna ask you these questions, and you can just say yes or no. Do you have sex with men or a man?
Yes.
Do you have sex with women?
No.
Do you have any injection drug use?
No.
Do you have any sex with an HIV positive person? Or that's what
Well,
it
that's kind of my question.
Okay, and
Possible.
you did say you have sex with a former injection drug user?
Right.
Okay. And do you have sex with a man who has sex with other men?
Not that I know of.
Okay. And do you ever have sex in exchange for drugs or money?
No.
Okay. And any STDs this year?
Well, let's see. I had some BV, but I don't know if that's really.
Yeah, I mean, bacterial vaginosis can be caused by just frequent sex, and it's not necessarily sexually transmitted irritation. Okay. So no chlamydia or gonorrhea that you know of? I mean, we can test you for all that today.
Okay, but not that I know of.
Okay. And did your mother have HIV?
No.
Do you have sex while using non-injecting drugs like marijuana or alcohol?
Alcohol.
Alcohol, okay. And any other sex with HIV/AIDS risks other than the no condoms?
No.
Okay. Okay. And are you a blood recipient ever or a hemophiliac?
No.
Okay. They test all the blood now.
Right.
Okay, but before '83 it wasn't tested universally. Okay. And are you a healthcare worker? Have you ever been exposed to a needle prick or any blood spills?
I'm a healthcare worker, but I've never had any
Exposure? Okay. And have you been victim of sexual assault this year?
No.
Okay. Any other acknowledged risk?
No.
Any tattoos from or piercings, you know, that you
No.
shared? Any other kinds of needles?
No, I had my ears pierced
A long time ago. Okay. And anything else, like any fights or anything where blood could have been shared, anything like that?
No.
Okay. All right. And you said you haven't been tested. All right, so what I like to make sure with every person is that if you got a positive result today, that you felt like, no, I don't think anyone's ever really ready, but I would be here to counsel you. But is there anyone you could talk to as well outside of me that you trust that we could call if that was the result?
Sure, I have a
And the other question is there any history for you of addiction?
No, I don't
Okay.
have.
So, I just like to ask that, because if it was a trigger for someone in recovery to get a positive result, then we want to talk about that, okay? Okay, well, I will be here through this process with you, okay? And if it was negative, we'll find other ways to keep you negative and figure out how to get your boyfriend in here, if that's what you'd like to do. And then if you're positive, what we'll do is, we'll get what's called a preliminary positive, 'cause this is a screening test, and we'll wanna get you a confirmatory test.
Okay. And can you explain what that
Sure.
confirmatory test would be?
So the confirmation test is, I would do it, if you had a positive, I would do another rapid, but it's still called preliminary.
Okay.
It's very accurate, but it's it's possible that there could be something else going on, so we do a blood draw, at the health department, and I could come with you to that. And they would draw your blood, and then they, send that to the state lab and test that. And they can actually test you if you're newly infected for, they can find out if you have acute HIV as well. And acute means usually in that first phase of getting infected.
Right, because I've been with my boyfriend for 3 years, so I
Okay.
don't know.
And I've had couples that have been together and one person's positive and the other person stays negative.
Okay.
And it just really depends. Okay, those good questions. So are you ready to move forward?
Sure.
Okay, so I'm gonna show you the test and we're gonna